My name is Robert Garwood. I'm a surgeon at Sentara RMH Medical Center in Harrisonburg, Virginia. I'm an advanced laparoscopically trained general and bariatric surgeon who performs laparoscopic inguinal hernia repair using Progripᵀ Laparoscopic Self-Fixating mesh. I've been in practice 10 years here and have performed over 600 laparoscopic inguinal hernia repairs. A large portion of my practice is seeing patients with symptomatic inguinal hernias. When patients present to my office asking for treatment options regarding their hernia, there are two basic options available: open versus laparoscopic repair. My preference is for a laparoscopic repair with mesh because I believe it provides superior outcomes and overall less pain over the course of the recovery period. Not only have I repaired hundreds of inguinal hernias, I'm also had an inguinal hernia. This was first diagnosed in 2012 and was not causing me too much difficulty. Being a stubborn surgeon, I chose the course of watchful waiting. Over the course of time, however, I started to develop symptoms and needed something to be done. My two passions in life are surgery and cycling, competitive cycling to be exact. And I first noted symptoms of my hernia while training for my favorite event, time trialing. Being somewhat a rigorous activity involving the legs and the groin area, symptoms were very marked during strenuous effort. And over time, the pain became too much for me to bear and was affecting my ability to pursue this passion. That's when I sought surgical treatment. Naturally, I chose with a procedure that I'm most comfortable with, a laparoscopic repair using laparoscopic Progripᵀ mesh. Why did I choose a laparoscopic repair? Well, simple. I have first-hand knowledge of the outcomes, which are excellent, and I also wanted to get back to my activities and passions, being cycling, as soon as possible. Proceeding with a laparoscopic repair using lap Progripᵀ mesh afforded me the best chance to do that, and I was not disappointed. In 2014, I was fortunate enough to reach my goal and win the race that was always my dream to win, World Time Trial Championships for age groups 50 to 54. As a patient, I had no regrets at all. I've been able to return to my normal activity both as a surgeon and as an athlete without problem. I've had no problems over the last 4 years, no pain, no recurrence. Everything has been great. When a patient comes in my office with a symptomatic inguinal hernia and asks do they really need surgery, my answer is yes. Most patients I encounter will ignore pain to a point and don't realize that their inguinal hernia is actually affecting their lives. It's affecting their ability to work, play with their children, to do the activities they love. Given my own personal experiences with laparoscopic repair using lap Progripᵀ mesh, I'm able to reassure my patients that this type of repair using lap Progripᵀ mesh will allow them to first take care of their hernia and, more importantly, return to the things they love to do.